Hello, my name is Rubina and I've been working with the International Foundation for Mother and Child Health for just over a year now. And last week I was lucky enough to be in Pakistan, joining the team there and seeing some of the work that they're doing to help make a difference there to the lives of women and children. And being back a few days now, and now that I've had a chance to reflect and kind of internalise everything that I've seen and everything that happened, I just really want to share my thoughts and experiences with you guys and everyone, because it's really kind of opened my eyes to the reality that people live in Pakistan and to the work that the organisation is doing. I feel like I have a renewed level of respect and passion for the organisation after seeing with my own eyes the work that they do. So I just thought I'd give you a short kind of reflection diary on my few days there. So the first day when I arrived, I flew from Lahore to Karachi and straight away got in a car and we had hospital meetings. And we had a meeting with Indus Hospitals, which is one of the first, I believe, free hospitals established in Pakistan. And they're now chains and they have hospitals up and down the country. And we had meetings with their team to kind of see their kind of history and blueprint and how they got to where they are today, and how our organisation can adopt some of the same strategies for our own hospital. So if you don't know, our organisation, our first project that we're doing is we're trying to build a free 150 bed hospital for women and children, a maternity hospital in Mirpur Sakro. And the following day, early morning, we drove there. And every Monday in my office, I get updates from the Pakistan team, showing me pictures of the hospital, giving me updates, because we have an outpatients clinic there already. So it's been operational for a number of years. And every Monday I get sent the name of the patients, their age, what condition they have, and the medicines that they receive for free. And you know, my boss is always telling me stories and giving me examples of how far people travel to get to our hospital. He once told me that there's some families that the doctors there know of that get boats and ferries from small islands off the coast of Karachi and then walk kilometres and kilometres just to get to our clinic. And seeing the hospital, driving up to it, this hospital site and the outpatients clinic with my own eyes, I can just say that I was kind of blown away. It was a really surreal experience for me. You know, seeing the pictures and seeing the videos didn't compare to what I saw in my own eyes. You know, this place is almost 3-hour drive from the city, and it just made me think the day before we were having meetings with this amazing free hospital that do amazing work in the city, and I felt really good, and it made me feel great that free hospitals do exist in Pakistan, and by no means are we doing anything different, but there is really an extra need for these free hospitals in the rural setting, because this is where the people live that don't have the means to get to the city, to travel to the city. So yeah, our organisation, it's going to be tough. It's going to be an uphill battle trying to establish a operational good practice hospital in the rural setting, but it's where it's needed the most. So when we drove up and parked our cars, the first thing that I noticed wasn't the construction site or our outpatients clinic. It was actually the 2 dozen or so families that had begun to squat outside our hospital. And I was informed by some of the staff and some of the team that these weren't permanent residents, they're communities that live in and out. But it really just personified for me the amount of poverty that exists in Pakistan. You know, these families had just put sticks in the ground and then very thin kind of cloth over the top, and that was their housing. And I was told that they'd stay here for about 20 days or so and then they move on. And yeah, I spent most of the day talking to our employees, so our doctor that runs our outpatients clinic that sees the patients every day, and the 2 watchmen. And just listening to their stories was really humbling, and it was great to see people that, you know, are sacrificing a kind of city job to work here, but hearing them speak, they have that realization that these are the communities that need it the most. And yeah, it was just a really inspirational moment, I suppose. And whilst the team were in meetings, I spent, like I said, most of the day talking to the workers there and also playing with the kids outside. And, although there was a big language barrier, children are children, and, a smile is a smile, and, they really enjoyed the camera. I was a bit hesitant at first to take any pictures of them, but they loved it. And I'm just going to share a little example with you. There was a girl, and she was holding her little sister. And when we arrived there in the morning, about 10 o'clock, 9 o'clock, I gave her a tissue because this little girl's nose, she must have been no older than 1.5, was just running and running. And I gave her a tissue. And we left at about 3 p.m. in the afternoon that day. And her nose was just continuously running. I just thought it was, but no, it was proper infection. And even though there's just one small example, it just made me think that, if this child is not going to have a long, healthy life, then education and everything is secondary. Without a good lifestyle and a good standard of health, then everything else is futile. It just changed my perspective, because I thought that education is the pillar, but it really made me realize that no, health is the pillar upon which everything else stands and grows. And children are the future, especially of Pakistan. I think it's 65%, if not more, of the population in Pakistan is under the age of 25. That is a staggering amount. So it's a growing population, so children are the future. So we really need to invest in their health. And the second day, we got a flight to Islamabad, and then we drove another approximately 3 hours or so to a place called Haveliya, which was near Abbottabad, northwest Pakistan. And we went there to deliver maternity training for local midwives, or dais as they're called in Urdu. So these are traditional birth attendants, because Pakistan still being a conservative society, a lot of women give birth in the home, and these traditional birth attendants assist. So yeah, I was really grateful to be able to see some of these education programs. But at the same time, I was really saddened at the lack of basic knowledge and information that these traditional birth attendants had. I won't go into detail, but I'll just say that it was quite shocking. That basic knowledge that I know, and I'm someone that has little to no medical knowledge that I'm aware of, and these women that are assisting other women giving birth had no idea of. And Pakistan, it has the third highest maternal mortality in the world, so it really kind of put things into perspective, and it was really saddening, like I said. And the following day we held another training session, which was about 1.5 hours, 2 hours drive up a mountain, which I really enjoyed. It was really fun going up there. And when we arrived, it was a even more rural setting than the previous day. It was up in the mountains and just a peaceful setting, and there was a school there in which we held the training. And again, we experienced some of the same stereotypes and the same neglect of basic practices from the women that lived underneath the mountain. We experienced it with these women as well that lived on top of the mountain. But there was definitely a willingness to learn, and I think it was the women realised that, so many of our own daughters and mothers are dying, and we need to do something about this. So it was almost like a bit of a cry for help as well. But I spent most of the day in and out, so listening in with Dr. Salim on the training session, as well as playing with the children. And, it just made me think that a woman's health and a child's health goes hand in hand. A lot of the children that were waiting in the playground were either the grandsons, granddaughters, or sons and daughters of the women that were having the training inside. And yeah, it just made me think that if a woman takes charge of her health and is committed to living a healthy lifestyle, and she's given that chance in life, then her children will go on to be healthier, and then they can go on to progress in life. It has a knock-on effect. So I was just kind of blown away, to be honest with you, by the work that we do. Like I said, seeing it on paper, seeing it in pictures didn't compare to what's being done on the ground. Tackling issues at the ground level using a bottom-up approach, and not only that, it's using education as a means of poverty alleviation and increasing health awareness as well. So these are like sustainable long-term solutions, which I really, really admire and which I really personally believe in, which I see are lacking overall, to be honest, with a lot of other NGOs. So, I mean, this is why I chose to join the International Foundation for Mother and Child Health, because even on paper, just looking at the 3 core pillars, I could see this commitment to long-term development and training and educating. So it's not ignoring that the hospital, our first project, this free hospital in Mirpur Sacro for women and children, it's not ignoring that it's in a society, which is in a nation, which is Pakistan. It's not ignoring that, so it's really working hard to kind of dispel some stereotypes and really educate and empower women. So overall, the experience was just really humbling and really changed my perspective, and I think it's really given me a refreshed and like renewed level of respect for the charity and passion as well. I'm really, really looking forward to working with them in the future, and you know, I just hope and pray that we continue to flourish and that everyone continues to support us. And I'd urge everyone to just keep an eye out, see what we're doing, have a look on our Facebook, on our website, sign up for our newsletters, because I can really testify now that the charity is doing some amazing, amazing work, which I'm proud to say that I'm a part of the team.